This screencast provides a short lecture that you should view in preparation for the seminar this week. The lecture will briefly cover the topic of guidelines in health and social care. In particular, the screencast will help you to develop your awareness of clinical health and service guidelines by covering the whats, whys and hows of them. So, what are guidelines? Well, Broughton and Rathbone, 2001, defined clinical guidelines as something that are systematically developed statements designed to help practitioners and patients decide on appropriate healthcare for specific clinical conditions and/or circumstances. And the COT states that the purpose of the guidelines they produce is to describe the most appropriate care of action to be taken based upon evidence, published knowledge and/or expert consensus opinion, allowing for reasonable variations in practice. The National Institute for Health and Care Excellence, or NICE, is one of the largest developers of clinical guidelines. They similarly define clinical guidelines as systematically developed recommendations on how healthcare and other professionals should care for people with specific conditions. The recommendations are based on the best available evidence. The guidelines are developed using a standard process and standard ways of analysing the evidence, which are respected by the NHS and other stakeholders, including patients. You may remember from your discussions in the seminars last year that evidence comes from sources such as professional clinical expertise and knowledge, local data, patient experiences and preferences, and research. Essentially, clinical guidelines take from all of these sources of evidence, pull together the best of it, and make recommendations on what to do. So, they go a step beyond research and other forms of evidence by advising on how best to practice based on the best evidence we have. Clinical guidelines are, however, just one type of guideline. There are in fact many types of guideline and all serve different and specific purposes. The broad categories within which guidelines fit are those specific to public health concerns, health conditions, those that are specifically written for a particular clinical or healthcare profession or discipline, and those that are sector specific. But these can cross over, particularly condition and discipline specific guidelines. The following slides will give you some brief examples of guideline types from these four categories. By nature, public health guidelines cover topics that are relevant to large groups of people and concern the health of the nation. They tend to range across a broad variety of topics that include things like health screening, dental and oral health, workplace health, and weight management. This workplace health guideline was created in 2016 by the National Institute of Health and Care Excellence and makes recommendations on a variety of aspects relevant to maintaining good health and well-being of employees aged over 50 in the workplace. It was developed for use by people with line management responsibilities. This community engagement guideline was created also in 2016 by NICE to help local authorities reduce health inequalities and to ensure local community health and wellbeing initiatives are effective. These guidelines are essentially developed at a national level and expected to be interpreted for use at a more local level to help improve local services. NICE expressly states that the application of the guidelines is not mandatory and does not override the responsibility of healthcare professionals to make decisions appropriate to local and individual circumstances, but that it should be taken into full consideration and used as a guide to help develop services. If you want to see more examples of NICE guidelines, you can do this from the guidelines section of their website. Guidelines are also often developed for use by specific professional groups. So whilst there is often multidisciplinary involvement with patients who enter the healthcare system, different professionals will have specific roles in the care of those patients and at different stages of the recovery process. Guidelines are often created to reflect specific professional practices or disciplines. These are often referred to as practice guidelines. This is an interactive flow diagram of a section from the stroke pathway developed by NICE. It identifies the entire pathway of the patient journey through the healthcare system from initial diagnosis. This section focuses on specific aspects of therapy and stroke rehabilitation. As you can see, the self-care section of this guideline identifies the occupational therapist as a key role in this area of therapy. Professional bodies and other similar organisations often create their own practice guidelines. If you visit the website of any professional body or Royal College, you will find guidelines that have been created for use specifically by those professionals. The Royal College of Surgeons, the Royal College of Physicians, general practitioners, for instance, all have their own good practice guidelines. Similarly, the COT currently has 6 practice guidelines, 5 of which are accredited by the National Institute of Health and Care Excellence. These are all available to download from their website and all make detailed recommendations on best practice in occupational therapy with various health conditions. Condition-specific guidelines are those which focus more broadly on the management of a health condition rather than the specifics of how one particular profession might be involved in the management of it. These guidelines are generally broader in coverage. For instance, these chronic fatigue syndrome guidelines produced by NICE provide recommendations on the various things such as presentation, diagnosis, referral to specialist care, managing setbacks and relapses, and review and ongoing management of the condition. These guidelines are not only for health professionals involved in the care of people with CFS, but also the families and carers too. The Scottish Intercollegiate Guidelines Network, or SIGN, develops evidence-based guidelines for NHS Scotland. This is a high-quality resource containing a range of condition-specific guidelines that are downloadable for healthcare professionals, carers and service users to use. And finally, the 4th type of guideline is the sector-specific guideline. These guidelines focus on the care of people with specific conditions in particular sectors. So, for instance, these guidelines produced by NICE help to advise on best practice for those involved with the transitioning of adults with social care needs between hospital and community settings. And this guideline focuses on the social care of older people with multiple long-term conditions. A search on the NHS Evidence or NICE websites for keywords that are sector-specific, for instance, social care or secondary care, will find you a wealth of practice guidelines relevant to those sectors. So, how are guidelines developed? Well, there are a number of things which need to be taken into consideration during the process of guideline development. The process tends to begin with a question about what information is needed. For instance, what guideline is needed and what specifically should it aim to do. It should consider what setting is relevant, whom the guideline is relevant to, and what issue is of concern, and this is usually a health condition. Guidelines development should include a range of different people. For instance, the points of view of healthcare professionals, other experts, patients, carers and funding bodies are all important voices in the preparation of healthcare and clinical guidelines. All these people have different expertise and experiences of the health condition in question, and all of this needs to be taken into account in order to ensure the guideline is realistic and applicable. So, what processes are involved? As previously stated, the process should begin with a clearly defined question around what the guideline is intended for. The purpose and scope of the guideline should be outlined, and the relevant people invited to advise on its development. Existing evidence needs to be considered, and a review and critique of this is an important part of the process. This may be done via a systematic review or considering the outcomes of other systematic reviews. Normally, a timeline will be set for developing the guideline in order that it is completed in a timely manner. And before guidelines are published, they should be reviewed by independent experts who have not been involved with the guideline development. Often a draft is put out for comment and consultation, and responses invited within a specified time frame. And once a guideline has been finalised, a clear process should be put in place for dissemination and implementation. Once the guidelines are in circulation, this does not, however, signify the end of the process. As new evidence is discovered through research and other practices, guidelines can, over time, become out of date. Good quality guidelines usually carry expiry dates or review dates and should be revisited regularly in order that they remain current, based on the best available evidence and therefore relevant to practice. So what makes a good clinical guideline? Good, high-quality clinical guidelines are characterised by a number of things. They should be informed by a multidisciplinary panel of experts that is made up of multiple stakeholders, so patients, carers, healthcare professionals, local organisations and funders. The recommendation of guidelines should take into account evidence, expert consensus, costs, resources, preferences and values. Good clinical guidelines should be valid, so by following them, it should lead us to achieving the results expected of them. They should be reproducible, so if using the same evidence, other guideline groups should come to the same results. They should be cost-effective, so following them should reduce the inappropriate use of resources. And through the involvement of key groups, individuals and their interests, the development of guidelines should be multidisciplinary or representative of the people they will affect. They should be clinically applicable, so patient populations affected by the guidelines should be unambiguously defined. Guidelines should be flexible by identifying the expectations relating to recommendations as well as patient preferences. This should mean that guidelines, if developed at a national level, should have the flexibility to be interpreted and adapted to more local and individual situations. The guidelines should also be clear. They should be organised, well written, well reported, and use unambiguous language that's easily understood by clinicians and patients. Their recommendations should be easy to find, and they should come with an implementation or use manual. They should be amenable to clinical audit. This means the guidelines should be capable of translation into local audit criteria. And as previously stated, good clinical guidelines should also carry an expiry or a renewal date, and the process of this should be stated. So, are there any drawbacks or problems with guidelines? Well, guidelines can be good in helping to standardise practice to ensure it is fair and equitable, and it is the best we can offer. However, guidelines that are inflexible can cause harm by leaving insufficient room for clinicians to tailor care to patients' individual needs and circumstances. Clinical guidelines don't always take into account the voices of all clinical professions involved. For instance, if important discussions around key guidance on, say, rheumatoid arthritis were to involve 30 medics sat around a table, one occupational therapist and perhaps 2 service users who are Skyped into the discussion, this is not likely to lead to a fair or balanced discussion, and there is likely to be a medical bias in the guideline that is ultimately developed. Guidelines are much less likely to be biased the more multidisciplinary involvement there is. And finally, why do we need guidelines at all? Are guidelines an aspiration to providing the best possible standard of care, or just a minimum standard? Are they a carrot to encourage healthcare professionals to offer high standards of care, or a stick to beat us with if we are not meeting a standard? This is a much debated question, and there are as many arguments on the negatives of clinical guidelines as there are the positives. But on the positives, fundamentally, guidelines are important for a number of reasons. Ultimately, they help to reduce wide variations in practice, they provide a minimum standard against which we practice and offer services, they provide a benchmark against which to measure service delivery, and they help to improve the overall delivery of healthcare. And to finish, you have 2 short tasks. Firstly, take a look at this short YouTube video on what makes a high-quality guideline. And secondly, reflect for a few moments on your most recent practice placement. What guidelines did you notice being used by occupational therapy and multidisciplinary staff? Do you think it made a difference to service users? This lecture has provided a brief overview of what clinical guidelines are, their nature and type, how they are developed, and why they are used in healthcare practice. If you wish to follow up on anything from this short screencast, you can find a related reference list on Moodle. This screencast provides you with supporting information to support your SOL task this week of critiquing a NICE guideline.